You don't do drains.
Right. So we'll take some stick about this, but it's okay. So the drainage is, so let's talk about a tummy tuck. So we'll talk about that for a second. So I recently had to do some recertification stuff. And many of the questions on the recertification portion of the examination I was doing were regarding tummy tucks, but not just a tummy tuck, a drainless tummy tuck. So basically we don't use drains in tummy tucks anymore. And you can do that because you create a little horizontal lines of sutures that decreases the space.
And quickly, for those like myself, drainage, is this to drain
a drain tube, like a plastic tube.
Yeah, but he wants to know
out.
what the fluid is.
So that's the edema fluid. That's the inflammatory fluid created by your body's response to surgery or injury.
Okay, so you don't need that. The body can get rid of that fluid.
Because he creates the things.
Yeah, so in a drainless tummy tuck, you cut down the space and you can compress the area, and that diminishes the amount of fluid production. So for the breast...
How does the body get rid of the fluid if you don't have the
lymphatic system? You'll absorb it.
You pee it out.
Yeah, you'll absorb it. And just like we put her on the balancer pro at our office, and she had to go to the bathroom like right after, that helps you eliminate it, right? Elimination is pooping, peeing, sweating. So when I do the breast, and this started with my fat transfer cases, basically, we all know that we can lipo from the breast pocket down to the chest. We've done this, breast pocket down to the abdomen, not the chest. Wrong direction. So when you connect those two spaces underneath the skin envelope, there's no need for a drain because all the fluid's just going to go down. Gravity always takes everything down.
So why does everyone do drains still?
I think it's just...
Because they're churning butter in the olden days?
Yeah, exactly. I mean, drains will get you two things. Or actually, let's do it this way. So everybody who operates for a living knows that a drain does not stop a hematoma or a seroma, but can lead to an infection because it's basically a piece of plastic.
That's coming from the outside of your body on, right?
So anything that comes outside in is bad. And if you don't need to have it, you don't want to have it. So as soon as we would do cancer operations and we were faced with, putting drains in folks because we had these huge, wounds to deal with, we wanted to get them out as quickly as we could because we knew the longer we left them in, the higher the chance of an infection.